So typically at our clinic, we notice, and research also confirms, there's a strong genetic link.
Mhm.
So it is not uncommon for us to end up seeing probably 50% of the family.
Wow.
And so sometimes they'll have their session at the same time, and one individual goes to that therapist and another individual goes to that therapist. So really, when I work with therapists on how to screen for OCD properly, it's really important to understand that family history. And because OCD is missed, not only do I need to know if mom or dad have anxiety symptoms, I need to know what that sounds like. What do we know about anxiety with mom? What do we know about anxiety with grandma and grandpa? What behaviors, do they kind of pique my interest a little bit? Because it's likely those older generations have not received that correct OCD diagnosis. And so when I press further on those questions, people will say, well, now that I remember my mom never drove on freeways, and or
Yep.
my dad would wipe down the grocery. And so they start talking about some of these behaviors that kind of pique my interest some. That, okay, maybe there is a line of some OCD behaviors. The most common misdiagnosis is people just think they have anxiety, or people have been diagnosed with generalized anxiety disorder. The difference is with something like GAD, anxiety tends to be more free-floating, and it tends to dissipate after something occurs. So maybe I am anxious because I have to give a presentation at a conference. That anxiety dissipates after it's completed, right? Somebody with OCD, their brain tends to have major themes. So fear I'm not going to be able to sleep tonight. Fear that something bad is going to happen. For kids, it may be a fear that an intruder is going to break into the house. Fear that I blurted out an obscenity or insult to somebody. So they're going to be having these major themes that no matter how hard they try to feel better about that fear, they're not getting relief. So no amount of rumination, no amount of seeking reassurance, no amount of tapping rituals, no amount of going back and checking gives them relief. And so that's the major difference I see. A lot of times people come in, maybe they're not ready for treatment, but they just want a diagnosis. Usually we can, within 60 minutes, we're able to provide a lot of clarity to what people have been struggling with for decades.